All right. Hello, everyone, and happy Friday. Welcome to our AI in Healthcare webinar. So, I am Madeline Abernathy, and I'll be the host today. I'm part of the marketing team here at Imperium Dynamics, and then joining us today, we have Sarah Howe, VP of Products here at Imperium Dynamics. Welcome, Sarah.
Hi, everyone. Welcome to our webinar.
All right. So, if you are new and joining us here today, we are Imperium Dynamics, a Microsoft partner based in downtown Chicago, dedicated to bringing your vision to life within the Microsoft stack. So, we aim to help organizations of all sizes achieve digital transformation by solving complex problems and delivering long-lasting impact through Microsoft Cloud solutions, with, of course, a focus on increasing both the capabilities of people and the performance of businesses. Okay, so just some housekeeping before we go ahead and get started. So first off, this session is being recorded. And after the webinar is over, you can access the recording on our website. So feel free to go ahead and revisit it or even share it with your colleagues. And then next, if you have any questions throughout the presentation, feel free to drop those in the chat and we will reply as we go. And then finally, we will also be sharing a copy of today's slide deck after the session on our website. And this is going to be on the webinar page. So this way you don't have to worry about taking detailed notes while the webinar is being presented. All right, and then moving on to our agenda today. So first, we're going to be looking at AI trends and outlook, then current industry challenges, then following that with AI in action, and then finally, the future of AI in the healthcare industry. Okay, so with that being said, let's dive right into what is AI with Sarah.
Thanks, Maddie. So, in today's world, AI is all over the place. It's growing so quickly, and everyone is talking about AI. What's the future gonna be like? How is it gonna affect our lives? But I really wanted to kind of just start by level setting and kind of talking a little bit around what is AI really, and what is it going to do for us. So AI, or artificial intelligence, is the ability for machines to mimic human thought processes and intelligence, and for them to be able to then learn and reason and help make decisions. So there's many different applications of AI, many types of AI, but what it really boils down to right now for everyone in the healthcare space, what can it really do? So there's a few different areas that I wanted to focus on, right? Content creation, whether you're drafting emails, written documents, or creating creative contents like images or visuals, you can save time by drafting or generating with AI. The second would be analysis, right? So we live in a data-driven world, and AI can really help us get meaning from that data and identify trends or insights that would be difficult for us to otherwise understand, and then be able to act on those. And then the last piece I wanted to highlight is automation. So streamlining and automating tasks that typically take a lot of time or maybe are prone to errors, to just reduce the level of effort involved from a human standpoint. So in summary, we can create things with it. We can also use it to help us with decision making, and we can also save time with automation. So those are some of the key areas. And in the healthcare space, some examples of that would be, assisting with diagnosis, automating administrative tasks, and personalizing treatment plans for patients. So in terms of AI, the industry, the implementation of AI in the healthcare space could save the US health economy $150 billion per year by 2026. Studies also show a 40% projected improvement in health outcomes when using AI for diagnoses. Today, clinicians can ask AI chatbots diagnostic questions and gain immediate access to a wealth of information and advice, saving hours or even days of searching on similar cases. It can also support clinical decision-making. When clinicians are looking at similar cases to predict who will best respond to certain treatment options, AI can help them to better personalize their individual treatment regimens. So now we can talk about some of the current challenges in healthcare and where AI can play a role. First, clinical applications. There's so many different clinical applications, but today one of the ones I wanted to highlight is right around doctors facing challenges with the way they have to work and the amount of time they have to spend documenting their visits in the EHR. That process is super time consuming and it inhibits that personal focused feeling for patients. And then, of course, like we've just touched on some of the diagnosis or understanding of which treatments are going to fit best with a specific patient. Then we have, administrative burden, so manual tasks like appointment scheduling, billing, follow-ups. Those can be very complex and very manual in the healthcare space, and those can really be overwhelming for healthcare staff and detract from their focus on supporting patients. Then we have regulatory compliance, so navigating regulatory environments like HIPAA and price transparency laws are very essential for healthcare organizations. And then, patient communication. We live in a digital world. Patients have high expectations when it comes to the different channels that they can use to interact with their providers. And fragmented communication systems are common challenges for providers. And then another area, referral management. So leakage is a big challenge a lot of providers are facing when patients don't follow through on their referrals, and that leads to gaps in care and, yeah, that it's costly for the providers. Over 10% of revenue is lost due to patients going elsewhere for care or not following up on a referral, and it also impacts patient health outcomes as well. So, what can AI do to help address some of these different challenges? From a clinical application standpoint, clinical documentation can be a breeze with AI. Physicians can minimize the clicks and screen time in the EHR, while AI-powered voice recognition transcribes the conversations between doctors and patients and then creates those into structured notes in the EHR. From a care plan standpoint, AI is transforming how treatment plans are personalized, enhancing diagnostics, predicting patient outcomes, and making clinical practices more effective. In the future, we could even achieve precision medicine, where patients are guided based on their unique combination of genetics, lifestyle factors, and environmental exposures to both predict risk for a specific individual of various conditions and also support choosing effective treatment plans. From an administrative burden perspective, um, there's many different ways that we can speed up some of these processes or reduce the errors and get higher success rates in various things like billing and coding. So billing and coding, AI can extract the relevant codes from the clinical notes to reduce errors and accelerate the reimbursements. It can also help in prior authorization by automating insurance verification and documentation submissions to speed up the approval process. From a appointment scheduling and communication standpoint, AI chatbots can handle all of the bookings, reminders, and rescheduling requests, which can reduce no-shows. And then we have, the claims processing, right? So using AI to detect errors or flag fraudulent claims and really just streamline that reimbursement process. And even in the supply chain side, AI can help predict and prevent shortages of inventory. And for referrals, AI can help match patients with the right specialists based on their medical history and the availability of physicians. And then, of course, at a population health level, we have, identifying at-risk patients and automating outreach for preventive care. From an RCM standpoint, too, AI can help analyze billing trends and optimize claims processing to improve cash flow. So, a lot of different applications, and those are really actually just a few, but different examples all across the different processes within the administrative side. When it comes to regulatory compliance, navigating the HIPAA laws and so forth, we can have better predictions or automation or alerts of where we're complying, or changes in policies that we need to take effect into our policies. And then from a referral standpoint, healthcare organizations often experience revenue loss due to patients not following up. With AI, healthcare providers can automate the tracking of referrals, do the follow-up outreach, and then ensure that continuity of care. And that can be through, emails, through text messages, even through IVR and AI-based voice calling. So those are, that's a broad spectrum of different ways that AI can play a role in the healthcare space and solve some of the current challenges that many providers are facing today. Now we can talk about, AI in action. We'll showcase a couple things. And to really start, of course, we're on the Microsoft spectrum. So Microsoft really has the most robust portfolio when it comes to AI capabilities. And Microsoft themselves are investing so much and continuously rolling out new ways of using AI within all of their different native applications, whether it's Office 365 or their business applications. And then with all of that data centrally stored within Azure, we're now able to build upon that and solve any of our different business challenges. So no matter what type of challenge you're looking to solve, Microsoft has a solution for it and allows you to build custom AI models to handle any of those different needs. A couple examples that we wanted to show today. Just two I wanted to kind of highlight and walk through here. The first one is in our product suite, Imperium Health Cloud. One of our AI features is the ability for clinicians to chat with the medical history of a patient. So really just taking all of the data in that medical record, and prior to an appointment, you'd be able to chat with the record and ask questions so that you have the most relevant content and history at your fingertips before you go into that appointment. So this application is actually embedded within the context of the EHR as well. In this example, it's Athena One. But doctors or nurses who are preparing to meet a patient can make sure they have the relevant information for that specific visit reason. And then when it comes to, larger health systems, they might have different departments that are on different EHRs based on specialties, or maybe, you've done a merger and acquisition and you have different locations, different hospitals on different EHRs, and you kind of want to have that single pane of glass or unified view. So here we're able to pull the data in from all of those different EHRs and consolidate them into a single record. And then you can also ask questions about that from a holistic perspective as well across all of those different systems. But so the goal here is really to give relevant context and give the information that clinicians are most looking for before they meet a patient, rather than them having to kind of click through the full medical record and try to understand what might apply to the appointment that they have. So it's a time saver and helping them to have better quality of care provided to their patients. Then the next example is Acadia. It's a document management system, and it's really for document processing. So it has many different features leveraging AI, from document creation and generation based on templates to being able to chat with your document and ask questions about the content of it, as well as search any of your documents based on different features or clauses that are included within them. We also have AI-based document comparisons to show the differences and highlight the changes between different versions. And then it streamlines the internal and then external review and approval processes, redlining and e-signatures. So this is a huge time saver for contracting, which is something that all providers, deal with frequently. And this is an example with many different elements of AI built into it.
All right. And then moving on to the next slide. So thank you for those demonstrations, Sarah. Those were amazing. So, all right, so we did find a few key insights on some current data on how AI is actually impacting the industry now. And these include, but aren't limited to, a positive impact on administrative burden, patient outcomes, and efficiency. So to start off with administrative burden, it was found that the implementation of AI in healthcare has actually significantly lightened the administrative load on physicians by about 20%. This reduction allows doctors to actually spend more time on patient care rather than paperwork and other repetitive tasks that lead to neglection of the patients. All right, so with patient outcomes, so nearly 75% of healthcare organizations report improved patient outcomes after adopting AI technology that integrates care journeys and streamlines patient communications. And then finally, with efficiency. So many Gen AI solutions are delivering a true impact by, for example, reducing medical and regulatory writing effort by 50%, and therefore shaving valuable months off drug launch times. Okay, so that was look at how AI is currently impacting the industry. Now let's jump into some data on what the future holds for AI in the healthcare industry. All right. So moving to the next slide. So it was found that 79% of healthcare professionals are actually optimistic about AI and its impact on medicine and robotics. And then following this, according to a report by Grandview Research, the global telemedicine market is actually expected to reach 155 billion by 2027. And AI is credited for being a significant contributor to this growth. And then next, in the future, AI is projected to reduce administrative workload of healthcare professionals by about 30%, allowing them to focus more on patient care and improving overall efficiency. And then finally, in North America, 48% of clinicians expect AI to actually play a major role in decision making within the next decade. All right, so now we're going to move on to how business applications can be leveraged here with Sarah.
Yeah, so Microsoft, as I mentioned earlier, has a complete ecosystem supporting business transformation and AI. So some of those key components are, having a unified platform. So Microsoft Dynamics allows you to consolidate patient data, including all of their medical history, appointments, and billing into a single system, enhancing your care coordination and patient relationship management, which also reduces your duplication of effort and providing a really seamless experience for your patients and clinicians. And then we have, AI-driven patient insights, right? So you can utilize AI and machine learning to get insights about patient care and health outcomes. And we have tools like patient-reported outcome measures module that allow providers to track patient feedback and utilize that for planning and analyzing their long-term health outcomes and predictions. And then we have, scalable and flexible solutions. So the Microsoft stack is extremely integrated into all of the applications we already use, like Outlook, email, and Microsoft Teams. But then it also allows flexibility and customization. So you can really tailor your workflows to your own organization's needs and scale as large as you need to go. And then from a security standpoint, which of course is extremely, extremely important in the healthcare space, we're safe in the hands of Microsoft Azure, which is fully HIPAA compliant, and it has top-tier data encryption and security controls, so you can ensure that your patient information is safeguarded. And when it comes to using AI, we're always using the AI within your own specific tenant and environment. So your sensitive data is not being shared outward with any third-party applications. It's all in your control and in your own organization's infrastructure. So that's kind of some of those pieces. Yeah.
Yeah, thank you so much, Sarah. That was amazing. And thank you so much, everyone, for joining our AI and healthcare webinar. So just to recap, we started by exploring AI's current trends, from AI benefiting diagnostics, decision-making, and even its ability to enhance patient experience. We then addressed industry challenges, such as referral leakage, administrative burden, and the struggle of regulatory compliance. We then dove into AI in action, where we demonstrated some examples on how AI solutions can be fully utilized. So as we've seen, AI is not just a challenge, but it's also the solution. And then finally, we looked ahead at the future of AI, where we discovered healthcare professionals are actually optimistic about AI, and that AI is going to play a major role in decision-making in the coming years, as well as decrease administrative burden. So we hope that you found this webinar insightful and gained valuable knowledge to apply to your business. If you'd like to scan the QR code to the side over here to learn more, feel free to do so. And if you have any questions at all, please feel free to email info@imperiumdynamics.com. So by partnering with Imperium Dynamics, you gain access to innovative solutions that address your challenges head on. So thank you so much for joining, everyone, and thank you so much, Sarah.